Let's study atrophic rhinitis. It is also called Ozaena. Atrophic means there is atrophy of nasal mucosa and the turbinate bones. Rhinitis. Itis means inflammation of the nose. So atrophic rhinitis is the chronic inflammation of the nose which is characterized by atrophy of the nasal mucosa and the turbinate bones. Ozaena means foul smelling. In atrophic rhinitis, the nasal cavity are roomy and full of foul smelling crust. Here we can see this roomy nasal cavity with crusting. This is roomy because the turbinates are going to atrophy. There are two types of atrophic rhinitis, primary and secondary. Primary atrophic rhinitis. The clinical features. On symptoms, mainly the patients of the atrophic rhinitis is the females and it starts around puberty. The patient presents with foul smell from the nose. In atrophic rhinitis, there is foul smell from the nose, making the patient a social outcast, though patient himself is unaware of the smell due to marked anosmia, merciful anosmia. In spite of the wide nasal chambers, the patient complains of the nasal obstruction due to large crusts. There are crusts filling in the nose. We can see this crust in the nasal cavity, due to which the patient will feel nasal obstruction in spite of the roomy nasal cavity. There is roomy nasal cavity because the turbinates are going to get atrophied because atrophic rhinitis. So there is atrophy of the nasal mucosa and the turbinate bones. So it is the roomy nasal cavity. Although it is roomy, the patient will complain of nasal obstruction. And there is crust forming. So when we try to remove the crust, epistaxis may occur. On examination of the nasal cavity, we see the full of greenish or grayish black dry crust. We see the crust covering the turbinates and the septum. And when we try to remove the crust, it may cause bleeding. When the crust have been removed, nasal cavities appear roomy with atrophy of the turbinates so much that the posterior wall of the nasopharynx can easily be seen. As the atrophy of the turbinates is so much that the turbinates are reduced to mere ridges. Nasal mucosa appears pale. Septal perforation and dermatitis of nasal vestibule may be present. Nose may show a saddle deformity. There is also atrophic changes seen in the pharyngeal mucosa, which may appear dry and glazed with crusts. These similar atrophic changes is also seen in the larynx. So the patient have cough and hoarseness of the voice. Atrophic laryngitis. Due to blockage of the eustachian tube and middle ear effusion, hearing impairment can also be noticed. Paranasal sinuses are usually small and underdeveloped with thick walls. There is thick walls of the paranasal sinuses. So, due to thick wall of the paranasal sinuses, antral wash become difficult to perform. Etiology of atrophic rhinitis. We have mnemonics for that. @hernia. H for hereditary factors. There is hereditary factor for the atrophic rhinitis. E for endocrinal disturbance. R for racial factors. White and yellow races are more susceptible than natives of equatorial Africa due to nutritional deficiency of vitamin A, D, iron and some dietary factors. Infective, Klebsiella oziana, Perez bacillus, diphtheroids, Proteus vulgaris, E. coli, Staphylococci, Streptococci, which is responsible for the foul smelling. So, hernia, hereditary factors, endocrinal disturbance, racial factors, nutritional deficiency, infective, and A for autoimmune process. For the treatment of the atrophic rhinitis, we have medical treatment and the surgical treatment. In medical treatment, we do the nasal irrigation and removal of the crust. For nasal irrigation, we use warm normal saline or an alkaline solution made by a powder of teaspoonful soda bicarbonate 1 part, sodium biborate 1 part and sodium chloride 2 part in 280 ml of water. If there is hard crust, first we lose the crust, then mechanically remove it with forceps or suction. Then 25% glucose in glycerin is used, which inhibits the growth of proteolytic enzymes or proteolytic organisms responsible for the false smelling. Local antibiotics is also used, which help to eliminate secondary infection. Stradiol spray is used. It helps to increase vascularity of the nasal mucosa and regeneration of the seromucinous glands. Placental extract can be injected submucosally in the nose. Systemic use of streptomycin can be used 1 gram per day for 10 days. This streptomycin helps to reduce crusting and odor as we have false smelling. So this can help, streptomycin can help to reduce the odor, and streptomycin is also effective against the Klebsiella organism. We give potassium iodide. It promotes and liquefies nasal secretion. On surgical treatment, we do the Young's operation. In Young's operation, both the nostrils are completely blocked just within the nasal vestibule by raising a flap. It is opened after 6 months or later. Mucosa may revert to normal and crusting is reduced by doing Young's operation. In modified Young's operation, there is complete obstruction of both the nostril. But in modified Young's operation, we avoid the discomfort of the bilateral nasal obstruction and we partially close the nostrils. In Young's operation, the nostrils are completely closed, but in modified Young operation, we partially close the nostrils. And we can also narrow the nasal cavities, as nasal chambers are very wide due to atrophy of the nasal mucosa and the turbinate bones. So we can narrow the nasal cavities. As nasal chambers are very wide in atrophic rhinitis, so the air currents dry up secretions leading to crusting. So narrowing the size of the nasal cavity helps to relieve the symptoms, and the techniques used for narrowing the nasal cavities are the submucosal injection of Teflon paste. We can insert the fat, cartilage, bone or Teflon stripes under the mucoperiosteum of the floor and lateral wall of the nose and mucoperichondrium of the septum. Section and medial displacement of the lateral wall of the nose. Secondary atrophic rhinitis. In secondary atrophic rhinitis, there is specific infections like syphilis, lupus, leprosy, rhinoscleroma, due to which there is destruction of the nasal structures leading to atrophic changes. Secondary atrophic rhinitis can also result from the long-standing purulent sinusitis, radiotherapy to the nose, and excessive surgical removal of the turbinates. So in atrophic rhinitis, it is basically the atrophy of the nasal mucosa, chronic inflammation of the nose, as it is rhinitis, so chronic inflammation of the nose, which is characterized by atrophy of the nasal mucosa and the turbinate bones. As there are being atrophy of the turbinates and the nasal mucosa, the nasal cavity will be roomy, and as the nasal cavities are wide, the air will dry up the secretions and form the crusts. So their crusts are formed. So due to crust, the patient presents with the nasal obstruction, and this crust will be false smelling. The patient will have anosmia, so he or she will be unaware of the smell. Patient is mostly common in females, as in etiology we see the endocrinal disorders. If we try to remove the crust, epistaxis may occur. On examination, we can see the greenish or grayish black crust which is covering the turbinates and the septum. On attempts to remove the crust, may cause bleeding. When we remove the crust, nasal cavities appear so much roomy that the posterior wall of the nasopharynx can be easily seen. Nasal mucosa appears pale. Nose may have saddle deformity. Septal perforation, dermatitis of the nasal vestibule may be present. These atrophic changes can also be seen in the pharyngeal mucosa, in the larynx. Due to blockage of the eustachian tube, hearing impairment may be seen. Paranasal sinuses are usually small and underdeveloped with thick walls. Due to thick walls, antral walls will be difficult to perform. On etiology, we have hernia, mnemonics. We have mnemonics, hernia. For the etiology of the atrophic rhinitis, hereditary factors, endocrinal factors, racial factors, nutritional deficiency, infective, and the autoimmune process. For the treatment, we have medical treatment and the surgical treatment. In medical treatment, we do nasal irrigation and removal of the crust, 25% glucose in glycerin, local antibiotics, systemic antibiotics, estradiol spray, placental extract, potassium iodide. In surgical, we do the Young's operation, modified Young's operation, and narrow the nasal cavities. This is all about the atrophic rhinitis. You can find these notes on the Telegram and links are given in the description. Thank you.